Coming up on the Doctor's Hospital podcast.
I predict that in the next 20 years, we already prescribe exercise, but we're going to be prescribing exercise or certain movements to treat things like bronchitis. That's where we're headed towards.
At Doctor's Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off lab, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctor's Hospital, trusted and best care now.
Welcome to the Doctor's Hospital podcast. I am your host, Alexis Burrows, Marketing Director here at Doctor's Hospital. And we are excited today to be joined on the show by Dr. Kent Bazard, who is a sports medicine physician, and he's just finding out is a longtime friend of the family. But that's
30 years.
Yeah, that's a conversation for off the record. But welcome to the show, Dr. Bazard. We're happy to have you here.
Thank you for having me. Always a pleasure to be with my Doctor's Hospital family.
Awesome. Wonderful. So I love to start off whenever I'm talking to a physician, especially for the first time in this sort of space, kind of get an idea of your background and your thought process and how you landed into the space of sports medicine in particular. So can you tell us a little bit, whether it's a personal story or something along those lines that kind of led you to say, I want to not just go into medicine, but specifically into the area of sports medicine?
Well, to be quite honest, I was on track to be a lawyer.
That was not what I was expecting.
Yeah, I figured you wouldn't expect that. But
Mind you have a lawyer look.
Very much on track. I wanted to be a lawyer. I used to watch all those lawyer shows when I was a kid. I liked the idea of being in court and around with the judge. That's essentially what I liked. Then I spent a summer or two in a lawyer's office, and I realized, and no offense to my lawyer friends, but I realized that it's just not that interesting. It's really not. All those words and all those books, not interesting. No pictures, no nothing. I was always a science fan.
Gotcha.
I was always a nature fan, and Lawn Greens, New Wilderness, and Nature of Things, and David Suzuki, all that stuff. I was always a nerd like that. So I just kind of followed where my best grades were. My best grades were biology. My best grades were all the science classes.
Makes sense.
So I went to college as a biology major. And while I was in college, my last year, ended up doing one of the first, maybe the second STEP program, the Student Temporary Employment Program at Doctor's Hospital. This is 1990 something. So that got me, that sealed it for me. And so med school, here I came and ended up at the University of the West Indies in Trinidad, which is a hell of an experience because the training is different from good school. And UE is a great school. They've produced some of the finest physicians in the world. But the MBBS degree is, and again, no offense to my colleagues, but it's an extremely difficult degree or teaching format in comparison to the MD.
Right.
Most of the world does MBBS, right? Nevertheless, and UE is one of the hardest schools.
Yeah.
It's a difficult school because one, there's no affirmative action, there's no sensitivity training, there's none of that stuff.
Nope.
They basically harass you into learning.
Yeah, it's like how people say New York, if you can make it here, you can make it anywhere. I feel like
Definitely.
UE is the New York of medical school.
A colleague told me, once you graduate, you'll be able to operate with a butter knife. And he's right.
It's powerful.
He's right, because once you finish your internship from a UE program, you're ready to go as a GP. You know what I mean?
I tell people all the time, though, like I have, my wife is a physician, so, I've heard and seen a lot of the stories. And one of the things that I find is it's truly amazing to hear she has a lot of friends who've gone off to do residency in the States, and you find so many Bahamians end up in that lead resident spot within a year of being there.
Yep.
You kind of hear that and you see that, and a lot of those are students who cut their teeth in UWI. So there's proof in that not just in our environment or in our space, but also it carries over into the wider medical community and the wider community of training when it comes to becoming a physician. So
Yep, and it also carries over into your practice and your work ethic. Because it's going through that hard time, and I would say internship in the Bahamas is one of the harder ones, especially since we don't have a lot of the restrictions that the other ones now have as far as hours. So, but it really makes you tough. It makes quote unquote a man out of you. But I wouldn't change it for the world,
Right.
even though it was not the most technologically advanced. We didn't always have things. But still, I wouldn't change it for the world. I wouldn't change my experience for the world.
Oh, that's good.
Once I finished UE, I was always an athlete, and once I finished the University of the West Indies, I started the residency, the radiology program at Princess Margaret Hospital, and I was there for a few years, and that's when I learned about what a sports medicine physician is.
Right.
And because we're still not very popular. The division of medicine is still only maybe about 30 years old. It's not that old.
Right. Modern medicine. Yeah.
Yeah. And I read about it and I say, you know what? I like this.
Mm-hmm.
Like I think I like this a lot.
Okay.
And once I did the first in-person, because it's kind of it's a distance program at UE. You have to go for a few months and come back, go for a few months and come back. Once I did the first rotation, I said, nah, this is me. This is it.
You were all in.
And now I'm happy. I'm very happy right now.
That's awesome. I mean, it's interesting. There's two things I want to touch on there. One, you're the second physician in a row on our podcast who's talked about going through the STEP program. So this is obviously a hallmark for the hospital. And we know that we've seen a number of physicians, a number of allied health workers who've gone through that program and come back into the environment in a lot of different ways. So kudos to that team that's running the program, and it continues to have that sort of impact. But two, when you go through a career path, and again, this is speaking as the husband, the spouse of someone who's gone through it, you really want to be able to say that you enjoy it when you come out at the end, because you spend so much time in training, in preparation. So much blood, sweat, and tears goes into it, especially you're talking about, the intensity of the UWI system, the program, that whole nine, the internship. You really want to be able to say when you come out on the other side that you're enjoying your day to day because you've put so much energy and effort into it.
Exactly.
But I mean, I guess along the way, you mentioned you kind of you got a taste of it. You got that first in-person encounter, and you were hooked. Is there any particular stories along the way, any particular patients, anything along, that journey that has really stood out to you and influenced your approach to healthcare?
Wow, there's quite a few. There's quite a few. As far as influence, let's talk about the influence that really targets sports medicine, because there are a lot of different patients can influence you in a lot of different ways.
Right.
They can influence you to say, I'm never going to do this specialty.
Right.
Right. Or they can influence you to say, this is not the lifestyle I want to live. I want to live this type of lifestyle. I don't want to see this. Some persons can manage pediatrics,
right,
or oncology patients, and some persons can't. You have to be a very strong and empathic person to be an oncology patient. You have to be a very understanding and patient person to be a pediatric physician. So once you go through the rotations, or you've seen a few of these patients in real life, that you say, okay, I'm not doing this. Right. So I have had a patient who, and this is recent as 3 years ago, who my first OA patient, my first osteoarthritis patient, 80-something-year-old man, bilateral knee osteoarthritis, horrible, like high grade, long-term
Right.
osteoarthritis. This is my first osteoarthritis patient. And he came to me in a wheelchair, couldn't walk.
Oh, wow.
So this is the first OA patient now. I'm treating on my own as a physician,
Right.
as a private physician.
Mm-hmm.
And I hope he's listening because I'll never forget him. But treating him, working with him, applying all these stuff, and I'm saying to myself, is what I'm doing really going to work?
Mm-hmm.
Because look at this guy.
Mm-hmm.
He's in a wheelchair. He can't walk.
Mm-hmm.
And, you know, today he can now work an entire gym session in a full-fledged gym by himself.
Oh, wow. That's beautiful.
So he went from wheelchair to cane to no cane.
Mm-hmm.
And now he's self-sufficient and pain-free,
Mm-hmm.
right? Still looking to maybe have a knee replacement surgery.
Mm-hmm.
And I still advise him to have it. But nevertheless, every time I see him, it makes me very happy.
Because you see the outcome of all of the work that went into it, right?
Exactly.
Which is, I imagine, being in a space like healthcare, it's probably one of the joys of it is when you see all of the energy, the effort, the hard work come out for a patient on the other side. Because I mean, I can't imagine.
It's that corny thing that it sounds really corny, and it is kind of corny.
Mm-hmm.
But that's the thing that really brings you satisfaction as a physician.
Yeah, it's one of those things when you're having a hard day, it's what helps you get out of bed in the morning. It's like, you know, there's people like this gentleman who came in a wheelchair that you have the opportunity to bring meaningful, you know, change to their life.
Right.
Especially at that age, because, you know, a lot of times people be like, you know, he's 80, you know, it's just, if he's in a wheelchair, that is what it is. But it's a beautiful space to kind of see the outcome. So, you know, you mentioned this a little bit earlier about people not quite, you know, understanding or appreciating what sports medicine is, what role it plays. So can you kind of give us, you know, just a quick and dirty explanation as to how sports medicine differs from other medical specialties?
Well, I could say that I learned a lot about practicing sports medicine after I finished the program, to be quite honest.
Mm-hmm.
But the approach we take to managing our patients is a little different.
Mm-hmm.
We're not fully, even though we're allopathic physicians, we don't firstly look at medication.
Mm-hmm.
You want to look at the whole patient, the patient as a whole, and you want to make sure that you're a problem solver.
Right.
And we're not just helping them get through something.
Mm-hmm.
You know what I mean?
Mm-hmm.
So if they succumb to an injury, and especially if it's something that's sports or activity related, or even a fall. I had a patient this morning with a fall.
Mm-hmm.
And after I let him tell his story, and I listened, and then I said, "Why do you think you fell?"
Mm-hmm.
And once you start to think like that, and you start to address why did you think you fall,
Mm-hmm.
you may find that there's something else that you need to deal with here.
Mm-hmm.
Did this person have weak limbs? Were they dizzy?
Right.
Do they have problems walking up the stairs? What is it?
Mm-hmm.
Because he may come to you for a shoulder because they hit his shoulder when he fell.
Right.
But why did you fall, actually?
In the first place.
You fell because your hips are weak.
Mm-hmm.
Okay, so let's fix that.
Mm-hmm.
You know what I mean?
Yeah.
Or you're going to fall again.
Right. So you're looking beyond just the treatment of what's happening in the moment, but it's the background of how did you get here?
Yeah.
And then how do we then resolve that part of how did you get here in the first place?
Right.
Because then that's where you kind of get the long-term benefit of not just, well, you know, your shoulder's banged up, we'll treat that, but it's, no, how do we prevent you from falling the next time?
Exactly.
You know, because your shoulder wasn't the issue. That's what happened as an outcome of your issue. Which is obviously a slightly different space than some of the other medical specialties that we know of. It's interesting that you mentioned kind of going back to the how did you get here in the first place? Because I know one of the things that, you know, as a part of doing this job that I'm in, a lot of it is reading, research, understanding what's happening in the medical field. And one thing that I've seen has been a recurring message from a lot of physicians, especially in this post-COVID era, is prevention, right?
Mm-hmm.
We've long heard the phrase prevention is better than cure. And in as much as it sounds medical on its face, that's not typically how people look at it. So from a preventative standpoint, you know, when you look at people who are, whether they're in the gym, whether, you know, they're just, I do my run or my jog every day, if they're an athlete, what are some preventative measures that you recommend for people to try and avoid having an injury in the first place when they're involved in any sort of, athletic or physical activity?
So we have a common perception in our community that once you get older, you should do less.
Mm-hmm.
And we know now in the sports medicine realm that that's nonsense.
Mm-hmm.
You have to maintain an adequate level of activity throughout your life,
Right.
the appropriate level of activity.
Right.
And one of the things that changes everything from energy levels to bone density
Mm-hmm.
to your appetite to your weight, of course,
Mhm.
and even affects your those comorbid conditions, hypertension, diabetes, regulates your immunity and your immune system is exercise.
Mm-hmm.
The motto of the Academy of Sports Medicine is exercise is medicine.
Mm-hmm.
And I predict that in the next 20 years, I mean, we already prescribe exercise,
Mm-hmm.
but we're going to be prescribing exercise or certain movements to treat things like bronchitis.
That's interesting.
That's where we're headed towards.
Right.
The school just released last year that the number one management for back pain
Mm-hmm.
for any reason
Mm-hmm.
is weight loss.
Mm-hmm.
Number one treatment. So when you think like that, it makes you realize that there's a different component to how we need to be managing our patients.
Mhm.
There's a different approach.
Mhm.
And even though in primary care and in family medicine, they engage this approach to some degree,
Mm-hmm.
sports medicine physicians go all in on this approach.
Right.
And so we go all in to the fact that we're not just saying you need to lose weight.
Mm-hmm.
We are now creating a program for you
Mm-hmm.
that's specifically for you to help you to lose weight.
Mm-hmm.
And it's not there's so much information out there and there's so much crazy stuff out there that you really have to take a scientific approach.
Mm-hmm.
And being a physician and being trained as a physician and a UE physician at that,
Mm-hmm.
your approach is different. Your approach
Right.
is different to say a person who, even a dietitian or even to say a personal trainer. A lot of people think that what we do is personal training, and it's really not.
Mm-hmm.
It's medical weight management.
Mm-hmm.
It's medical nutrition management.
Mm-hmm. Mm-hmm.
So yeah, and like I said, it's something that I enjoy a lot.
Yeah. It's funny you mentioned medical nutrition because National Nutrition Month is next month. We're gonna have the head of that department, Yvette Andrew Strawn, come on the podcast to talk about some of the things in that space. But obviously, again, this idea of preventative medicine, leaning specifically into things like weight loss, exercise, and nutrition has become such a hallmark and a calling card of this era of medicine in a way that's very interestingly different from
Yep.
the idea of prescribe, cut, that sort of space. So it is an interesting avenue to go down, because it does seem like this is where the world of healthcare is moving in a lot of ways. So it's going to be interesting to see how that continues to evolve and develop over time. Generally, I mean, obviously, you've been doing this for a while. You've seen a lot of different types of patients. What would you say are some of the most common injuries that people are at risk for when it comes to whether that's an athlete in term of a high school athlete, or even just somebody who does their regular exercising, works out in the gym? What are some of the common things that you see? And then how do you approach like diagnosing, figuring it out, and then treating those injuries?
Okay, so let's divide this into non-active persons,
Okay. So
active
me.
persons, so you, and then your athletes,
Right.
right? And probably most athletes in the BOMs are running athletes,
Right.
right?
Mm-hmm.
So for your non-active persons, the most common injury or issue that we get is back pain, low
Mhm.
back pain, right? Second, I would say knee pain.
Mm-hmm.
For your active, meaning your non-athletic person but still active,
Mm-hmm.
it's probably reverses. Knee pain first,
Mm-hmm.
then your lower back pain,
Mm-hmm.
right? And then, maybe if they play weekend tennis and things like that, they may get elbow and shoulder problems.
Right.
Your athletes,
Mhm.
especially your running athletes, and this is worldwide, the
Mhm.
number one issue is hamstring injury.
Okay.
And that's something that we should do some research on in our country because we
Mhm.
have a high incidence of hamstring injury.
Mhm.
And what I've found, just superficially observing athletes, is
Mhm.
that we have a high incidence of, could I say, paratoe.
Mhm.
We have a lot of athletes that have flat feet
Mhm.
and our paratoe.
Mhm. Just genetics in our
Just
country.
genetics. I see a lot of it. I don't
Right.
know if it just means that I'm seeing a lot of it, or
Mhm.
or if it's really
Indicative of
yeah.
right.
So some real numbers need to be taken. So some real research needs to be done. I think it's worth
Mhm.
doing.
So are you seeing a higher incidence rate here of hamstring versus athletes in other
It's high everywhere.
right?
It is high everywhere.
Okay.
But the question is, does the fact that we have such explosive athletes
Mhm.
who may have these slightly different angulations in their knee
Right.
and their feet,
Mhm.
on their ankles,
Right. Not to say deformities, but
not deformities,
but
but
things
just
that are different, right?
because you can be a perfectly excellent
Right.
athlete
Mhm.
with this issue,
Right. But
but
you
you're
don't know.
prone to
Right.
you're
Is that
prone to hamstring injury.
influencing you being more prone to that sort of injury?
Right. And is it a real thing or not? And I would like to compare it to once we get this done, and so anybody hearing, feel free to sponsor the research. But
God,
can we compare this to a dietary intake, which I'm big on?
Right.
I'm very big on nutrition. My athletes, if they hear me, they're gonna cringe because I'm always talking about nutrition.
right.
And as a matter of fact, new information is coming out about the effectiveness of your post-workout and post-exercise nutrition, especially when you're injured.
Right.
So your injury-free nutrition should be optimized for what that injury is. Someone with a hamstring injury
Right.
should have a certain, or musculoskeletal injury would have there's some particular nutrients
Right.
that we should be focusing on. Their hydration needs to go up, things like that
Mhm.
needs to be adjusted.
Right, because essentially what you're trying to do is you're trying to put the body in the best possible position to recover and regain function in that specific area, not
Absolutely,
just a general. Okay,
We get our fuel from the sun and from food we eat.
right.
That's it.
So I guess the second part of that question then was, how do you approach diagnosing and then treating those injuries?
Right. So just like any physician, there are standard examinations for each joint and each body part, and there are so many that, in fact, they sometimes conflict each other. You have O'Brien who says, "Well, do this that way," and it says that. And you have McGregor who says, "No, do it this way," and it means that. So, and it's the same joint. So you kind of have to, as a physician, you have to take the medical approach and say, okay, what's going on with this patient? I did this test and I got that. I did this test and I got that. I know my anatomy. I know my physiology. What is the history of this patient? And then you come to your diagnosis. And it's usually not a problem. And usually you can do that without imaging. You might have to add some imaging to that.
Depending.
That always helps, but that's not gonna most time, that's not gonna hold back treatment. That's not gonna slow us down.
Right.
So just like this must be the credo of University of the West Indies: history and examination.
100%.
History and examination.
Doctors Hospital is reimagined primary care. We have invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations across New Providence, Grand Bahama, and Exuma, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.
Going back to that conversation around prevention, are there any specific training techniques or exercises that athletes, like I know you mentioned this different type of athletes, you have, your I don't want to say gym rats, I'm sorry, that's the only, but your people who are doing like lifting, sorry, let's put it that way, weightlifting, I can't say that to a gym owner, definitely not. But you have your weightlifting as a core tenet. You have people who are runners, like you indicated. So are there any specific sort of training techniques or exercises that people in those different spheres or categories of athletes should incorporate to prevent injury? Is there anything that works in that space of saying, well, if I people like to say stretch, right, as a general rule, but I mean, beyond that or inclusive of that, what would you say are methods or techniques that people should incorporate?
So injury prevention is a whole area.
Right.
That's a whole semester.
Mm-hmm.
Right. So, and it's very specific. It's sport specific. It's age specific.
Mm-hmm.
Once we cross 40, stretching or warming up is important.
Right.
It's thought to be less important as you're younger.
Right.
Right. Some studies find no use or no benefits for stretching or warming up
Oh, wow.
before an event in a certain age group for certain sports.
Okay.
Right?
So it's very it's like this matrix where you have to figure out where you fall
Exactly.
in the
Once
X and
you
Y
cross
axis.
40, warming up is a great idea. Me personally, I warm up, but I warm up specifically with the exercise I'm doing.
Right.
So if I'm doing a bench press, I'm not
Mhm.
going to just grab 265 and start benching.
Right.
I'm going to take
Warm
the
up.
bar
Mm-hmm.
and I'm going to do the same bench press. I'll
Mhm.
do like 40 reps with the bar.
Mhm.
Then I'll rest and then start.
Okay.
So for me, that's
Right. So you're warming up the actual body part that you're about to go and focus on.
I'm not going to do a Y stretch because
Mhm.
I'm not going to. My shoulder's not going to be in that position when
Right.
I'm doing the bench
Or
So-
run on a treadmill to warm up
so-
for
right.
bench pressing.
So
Yeah.
so it's useless
Mhm.
in that regard. So warming up is more than just raising core temperature. Warming up means, getting your the joints you're about to use used to the range of motion and the load that they're about to carry.
Mhm.
Get them prepared.
Mm-hmm.
All right. Injury prevention though with athletes and sports can get extremely specific.
Mm-hmm.
But you want to take the approach of you want to target the more popular injuries. So for our track athletes, hamstring.
Mm-hmm.
So that's your number one preventative program you want to focus on with your track athletes
Mhm.
is the hamstring injury. That's the one that's going to keep them off the track for a long time.
Mhm.
With basketball players, it could be basketball, volleyball, maybe tennis,
Mhm.
certain other sports, your ankle and knee injuries.
Right.
With tennis again,
Elbow, shoulder,
elbow, shoulder, your baseball pitcher,
Mhm.
elbow, shoulder.
Tommy John. Yeah.
Right. So you want to make sure you want to make sure that one, you've assessed the strength in all the muscle groups that control those joints,
Mm-hmm.
making sure that they're well balanced. I had a judo player who was very imbalanced. He was so muscular on one side and very not muscular on the other side.
Oh, wow.
And found out is from doing one move over and over and over and over again
Mm-hmm.
on the same side.
Right.
All right. So, you have to take into account when you talk about prevention now,
Mm-hmm.
he's going to blow out that shoulder
Yeah.
because it's
You doing so much on that side.
all the load is on one side.
Right.
So when you explode, the other side can't brace.
Right.
You don't have any counter movement on the other side.
Mm-hmm.
So biomechanics
Mm-hmm.
is another subject that I love.
Mm-hmm.
And taking the biomechanical approach will help you to create, and the sport-specific approach and also the patient-specific approach
Right.
will help you to design good prevention programs.
Yeah, it's funny. It's like instead of having the horizontal, you only do arms or you only do legs. You only did one side, and I guess it's funny. It comes back around even in training or athletics, everything in moderation, right? You gotta have balance.
Yep.
I mean, it makes perfect sense. You kind of see it in so many spheres. Why would it not be appropriate here? Again, coming back to that conversation, you mentioned nutrition. And the performance of an athlete, so kind of taking it into a slightly different sphere. Can you kind of connect the dots between nutrition, energy levels, and optimal performance, whether that's as an athlete or an active person?
That's a matrix of dots. So to kind of it's hard to put everybody in the same grouping because when you talk about performance of a high level athlete, that's a little different
Correct.
requirements.
Right.
Right?
Yeah.
So I like to use cars as an analogy. We car guys. All right.
Perfect.
So we're car guys. So I always tell my athletes, if you take my daily driver is a Kia Soul, so 1.3 liter engine. If you take that Kia Soul motor and you go and you put that in a tractor trailer and you try and race it on the track, where are you going?
Nowhere fast.
Nowhere
Not even
really?
fast. Nowhere slow.
Nowhere slowly. But I said, if by some miracle you can take that tractor trailer motor and put that in the Kia,
Oh, you are going to the moon.
yeah, you probably won't be able to stop.
Right.
You're going to hit the wall.
Yeah.
Right. So what our athletes do a lot, especially our track athletes, and I route them for it all the time, and the parents too. They have almost nothing to eat on their big exercise day, which is a competition day. Swimmers do it too. They go to the track empty or near empty.
Right.
You're at the track all day.
Oh boy.
And sometimes, or you're in the pool all day. You're out in the sun all day. And sometimes they don't even start in the morning. So your race may not be in the morning.
All right.
But you're there from 8.
Afternoon race, right.
And your race is until 3 o'clock. So you're there all day. What do you think that energy is doing? It's
depleting.
It's depleting.
Yeah.
So by the time you go to compete, you're not optimized.
Yeah, and especially when you're talking about athletes, like I've seen different athletes talk about their intake. Obviously, my go-to when I talk about this particular part is like The Rock. You see what The Rock eats as his thing when he's in the space of bulking up.
Exactly.
Right. So if your idea is you eat at a certain caloric intake on a daily in preparation for whether it's swimming, running, whatever else, when you get into that space of, okay, now it's performance day, you can't just, what you're saying is you can't just go and say, well, okay, I'm not going to take anything in and then expect to operate in a way that's optimal.
Right.
Because that just doesn't compute.
Right. But also, you cannot start eating, optimally the day of or the day before.
Right.
This is something that has to be going on for a period of time. The same way, in some cases, you need to get a steady state of a certain medication. So you have to take it for a while before it starts to take effect. Right? And even after you stop taking it, then it's still in your system for a while. So it's the same way when you're feeding your body these nutrients, when you have this certain caloric intake, and your body needs time to acclimatize to that. You'll get some benefit. But as far as the long-term benefit, that's very important. And the most important time to apply this is when you're training, not competition day. That's not the day to have a come to Jesus moment and say we're going to eat properly.
It's like people who decide that they want to cram, the night before the final exam or the SAT or the BGCSE, and you do nothing in preparation, but those 2-3 days before you're just trying to get everything in. It doesn't in the same way. It doesn't typically work in that environment. It doesn't work in this way as well. Okay, so that's good to know. Again, in that nutrition space, you have any practical tips for maintaining a balanced diet? And then, any myths out there that you want to dispel about like complex nutrition plans? Because, there's fad diets, there's all of these different things that exist in that space. So kind of give you a chance to stand on your soapbox and dispel any myths or any things that kind of,
Boy. I'm going to need police protection when I leave here. No.
Leave the CrossFit people alone.
No. I just think that there's so much. Okay, here's the first thing. Every plan is not for everybody.
Fair.
There's some things that I have a lot of bodybuilder buddies, and there are things that some of them do that I would never do. I would never advise anyone to do, but it works great for them because of their sport and what they do. Right? So that may be okay for them, but for running a marathon, probably not. Yeah. So you have to take the approach that you need to eat for what I'm doing. Right. And you don't only need to eat to grow, you need to eat to recover. Right. So I'm always, whenever we're leaving a session with my athletes, I'm like, okay, what are we eating? What's for dinner? You're going to have a protein shake before you leave. And one of my big mantras, what I say a lot, what is not measured does not exist. So when I talk to like a medical patient and I say, how are you eating?
See, we can't be friends.
What is not measured does not exist. You can't tell me you're eating enough.
I can't let my wife listen to this. You can start measuring everything.
When I ask you how much, so when I say, are you getting enough protein? You're like, yes. Okay, how much?
How much?
How much? I don't know.
So then how do you know if you're getting enough?
Then you're not getting enough.
Right.
You're not.
Or you might be getting too much in because it could vacillate either
I'd rather too much than not enough.
Fair.
Okay. I'd rather too much. Too much off a person with renal disease and things like that.
Okay. Understood. One more thing before we move off of that topic. I know there was a trend at some point in the last few years of people who were, I think, taking pre-workout, the powder just like dry, raw. Any thoughts on that, especially when you talk about student athletes? Just anything you want to add to that conversation, because I know that was a big thing in that circle for a while.
It's a big thing. People still do it. Bodybuilders still do it. They do it for anything you're doing for more of a high is risky. I say always use any product as the manufacturer instruct you to use it, and that's always the best way to go. Anything else, because you're changing around the absorption and how you're taking it in as a dry powder versus mixed in a liquid. That's just two different things.
Yeah, it's the two different mechanisms of how it ends.
Two different absorptions, two different absorption rates. Why mess around with that? Just take it the way they said to give it to you. You're still going to get it.
Right. So on the recovery and rehab side of things, obviously this is a space that you will sit in. How do you help athletes navigate that recovery process and return to their sport safely? And that's both from the physical aspect as well as from the mental aspect.
Education, developing good habits. So nutrition is a big part of that. Your post-workout routine is a big part of that, whether that be some type of foam roll, massage, or stretch. Many of these things you can do yourself. Some persons have access to get professionals to do it. I like cold showers. Ice baths are very popular now. Very, very popular because they decrease inflammation. They reduce what's called delayed onset muscle soreness, DOMS. So ice baths tend to reduce those. It reduces inflammation, and people seem to love it. Lastly is decrease your screen time. They need sleep. Sleep, and more sleep. So good sleep habits, decreasing the screen time at night, putting your phone down, especially with teenagers, before you go to bed, and get adequate, and not just adequate, but quality sleep. Yeah.
I've seen and I've heard, I haven't personally experienced, but I've definitely seen a lot of conversation around the ice baths, the transition from extreme cold to extreme heat as a part of this methodology.
Doing that a few times.
Right. The back and forth. You've seen a lot in the space of lifestyle medicine, which is obviously starting to pick up steam as well in this space of trying to be preventative, trying to operate in a slightly different space than just prescribing. But yeah, it's definitely something that seems to be gaining a lot of traction again, not just in the sports and athletic community, but also out into the wider medical space. So definitely seeing people talk about the benefits of that. So just a couple of quick hits before we wrap up. One, technology. How does wearable tech, how does that fit in? Are there benefits to it? Are there any drawbacks? What would your advice be in terms of wearables when it comes to, the space of athletics, active individuals, even non-active? Where does that fit?
Well, technology is exploding, and on the horizon right now is AI, of course. Being able to record an athlete's movement and then determine what their capability is before they even achieve it. That's where we are now with technology. So the biggest drawback is accessibility and cost. That's the biggest drawback with technology. Most people have an iPhone, Apple Watch, and things like that. Those are less accurate than the real thing, and less accurate than the more expensive versions.
Right.
So that's the challenge there. I see they have an ECG watch that's supposed to tell you when you're having a heart attack.
Right.
Risky to me, but the technology will improve.
Right.
As the years get better, and it will become cheaper and it'll become more accessible. But that's the biggest challenge right now is accessibility and cost.
Any quick pieces of advice for athletes looking to optimize their performance while also minimizing their risk of injury?
I think we have the physical part down pat. We have excellent coaches. We have, to some degree, not the best in the world, but we have adequate training facilities. What we need to optimize is our nutrition. That's the problem with the entire country, really. There's easy access to fast and less healthy food than there is to healthy food. Healthy food is expensive. And it's hard to find.
Okay. And then any final words of encouragement for our listeners, both athletes and non-athletes alike?
There are so many athletes trying to achieve their dreams, their athletic dreams, and my advice to them is all the corny stuff. Yeah, don't give up, blah 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 blah. But make sure that you align yourself with persons who can help you along the way on your journey. Your coaches are there to help you. Physicians like myself are there to help you. Your physiotherapists, your massage trainers, all of these guys are part of what you will need even when you get to that extreme level. So to have them now, we didn't have massage therapists and physiotherapists and things like that when I was in school, running track and field. You went home with your pain.
Yeah.
and you came back. Your mom did something and then you came back.
Right.
You know? So I think where they are is in a nice place, but just to make sure that you utilize the tools and the persons that you have around you supporting you. Government support has increased maybe tenfold from 30 years ago. You got a nice big stadium and all this stuff.
Right.
So make sure you, one, align yourself with those persons who are supporting you. You live in an age where information is readily available to you. You can get information on your technique. You can communicate directly with experts in the field and they will answer you.
Right.
Just like that. So take advantage of these things and make sure you utilize them to the best of your ability.
Awesome. This has been an absolutely amazing conversation. Our production person is telling us that we went a little bit long. But I want to give you one final opportunity. Let the people know how and where they can get in contact with you if they want to get more information, if they're interested in signing up for your services. How can they get in contact with you?
Yes. Well, my private office is in the Seagate Plaza inside the Empire Fitness Gym. You can reach us there at 364-2001. Besides that, I run, of course, my external clinic at Doctors Hospital West Plaza for now. I'm there on Mondays, and that is walk-in, or you can make an appointment at the Doctors Hospital website.
So for our listeners, 302-4710 is the number at Doctors Hospital West, and the website is clinics.doctorshosp.com/DHW, and those would be the places where you'd be able to call or sign up for an appointment. No referrals needed, right?
No.
Okay, awesome. Again, great conversation. Thank you so much, Dr. Bazard.
You're welcome.
I know you have to get off and run, but this is a great chat. We're glad to have you on. And obviously, there's a lot more in the world of sports medicine we can talk about, so we hope to get you back on the show again soon.
Thank you.
All right.
Thank you for having me.
Thank you to our listeners. Remember to like, subscribe, comment, share, and we'll see you back next week on the Doctors Hospital Podcast.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now.
Go to doctors.
3 advanced facilities at Collins Avenue, Carmichael Road, and Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?